Good afternoon, everyone. My name is Kim Grady, and this is my discussion question for Unit 1 for MN664. I'm so excited to still be on this journey to becoming a PMHNP, and I'm looking forward to what this term holds. I've been rewarded in each term with some new knowledge, so I'm sure that I'm going to gain some more knowledge as I go along for this term. The question that was asked is, what am I currently doing? What is my current employment? And I am working as a nurse consultant for the Maryland Department of Health school-based health centers. And mainly what I do is quality assurance to make sure that the 89 school-based health centers across the state of Maryland are meeting and complying with our standards set by the Maryland Department of Health. One of the things that we are emphasizing, which actually ties into what I'm doing now, is that they are requiring that behavioral health programs be in all of the school-based health centers. So the state of Maryland nicely has dedicated over $100 million to making sure that behavioral health is accessible for all the schools across the state, not just the school-based health centers. So what I do is make sure that they meet the regulatory requirements, either have a program within the school-based health center or have access to one within the community. And I think this is going to be very rewarding for the children as we go along, since they are sometimes the ones that are most affected by so many different mental health issues, and now they can get real time help with those. Um, what I'm looking forward to hearing more about is I'm always very focused on trauma informed care, and I'm very interested in adverse childhood experiences, because what I learned last semester in a lot of the interactions that I had with patients is a lot of it started out. I was abused as a child, I went through sexual abuse, emotional, physical abuse, and it seems to have carried on into the adult years. So I would like to learn more about how do you bring this up to a patient when a lot of them was saying last semester, they were saying, don't worry about it, it's in the past, I don't want to talk about it. How do you get people to the level to want to talk about it? And I realized that even in my own family, there are several of my family members that have had adverse childhood experiences. And in my role as a forensic nurse, I'm also a forensic nurse, and I still work in that capacity. I have seen so many children that have been victims of sexual abuse, physical abuse, and also grow into parents that are victims of domestic violence and sexual abuse. So the triggers that I'm concerned with, and I've actually addressed with my last preceptor, is I worked before as when you're working as a forensic nurse, you're the evidence collector. When you're working as a PMHNP, you're going more into the psychotherapy and the medication management for that mental health illness that has been identified. I am good at listening, I am good at understanding, but I want to make sure that I can still maintain a professional existence, even though, your heart sometimes bleeds for people. So I recognize that that may be one of my, I wouldn't call it a weakness, but it's an area that I need to be aware of doing too much. So right now, I feel that my cure for that is that I do therapy. I have a therapist that is wonderful, and she's been very open to me, knowing that I'm going through this process to become a PMHNP. And I've been able to talk to her many times when I get to subjects that I'm concerned about, or I feel that are more emotionally or more realistic to me because I've experienced them, or I have family members that have experienced them. So I still believe in self care. I'm a big advocate for self care. I know what makes me relaxed. I know how to walk away from situations, and I know how to calm my mind down and focus in on other things. And I'm going to still continue that same process as we go along. I'm looking forward to meeting everyone, looking forward to our discussions and seminar, and I'm just looking forward to this section, or this preceptor and clinical opportunity, because I think it's going to be a great one for me. Take care, everyone, and have a good day.